Your hospital is now working with a new progressive chest drainage system, taking chest drainage management to a new level of care, Thopaz Plus. Thopaz Plus was designed to support the early mobilization of patients and to allow an objective assessment over time of the parenchymal leakage and information on the drained fluid amount. It will also help reduce chest tube duration and therefore the length of hospital stay for patients. In the next 6 minutes, you will learn how to safely handle Thopaz Plus in the post-anesthesia care unit, the intensive care unit, and the ward. Please watch carefully to guarantee a safe and successful therapy afterwards. Transporting Thopaz Plus. Thopaz Plus must not be placed on its side, as this may cause the filter in the canister to clot. It will also deem the fluid level measurement void. Instead, hold Thopaz Plus by the handle and keep upright when transporting. There are 2 types of hooks located on the rear of Thopaz Plus, a bed holder and a rail holder. Pull them out manually and place Thopaz Plus onto the rail as demonstrated. If Thopaz Plus does not attach, contact your local sales rep for a bed rail adapter. Charging Thopaz Plus. There are 2 methods of charging Thopaz Plus. The power cord can be plugged directly into Thopaz Plus by lifting the plastic cover. The charge bars verify that the power cord has been attached correctly. Alternatively, use the docking station to charge Thopaz Plus. The docking station is recommended for the most accurate fluid measurement. Pick up the docking station, turn over, and carefully place the power cord into the socket. After attaching Thopaz Plus, you will then see the charge bars, which verify charging. When using a 2-liter canister, make sure that you attach the adapter to the docking station. Check therapy progress. On the left side of the display, you can see the current size of the air leak. On the right side, you see the total drained fluid amount since the start of the therapy. In the button bar, the set pressure you are currently operating with is displayed. To view the patient air leak history, press the Up button. This will display 3 graphs showing the patient's air leak over 72 and 24 hours. To go back to the main screen, press the Home button. To view the patient's fluid history, press the Down button. The display will show 3 graphs showing the patient's fluid drainage over the predefined time periods. To go back to the main screen, press the Home button. Reset fluid display. To reset the measured fluid amount to 0, press the Reset Fluid button down for 3 seconds until you hear a beep. Thopaz Plus now displays an additional parameter, where you can see the time of the last reset and the volume of drained fluid since the reset was made. To reset again, press the Reset Fluid button for 3 seconds until you hear a beep. Changing canister. To change the canister, you must first clamp the tubing. Clamp as close to the canister as possible to prevent fluid leakage once the canister is removed. Hold down the Standby Mode button for 3 seconds. Thopaz Plus will then revert to Standby Mode. Press the blue button to release the canister. You will then need to remove the plastic seals from the side of the canister and place them in the holes on the rear of the canister to seal. Place Thopaz Plus on its side. Check that the label on the new canister is undamaged. Now insert the new canister as demonstrated and click to lock in place. Place Thopaz Plus upright on a flat surface and ensure that the correct canister size is detected. Press the on button to resume the patient therapy. You can now unclamp the tubing. To ensure the tightness of the system, check the credibility of the current air leak value for a few seconds. Alarm management. Thopaz Plus distinguishes between yellow warning notifications and red alarms. You can silence the alarm by pressing the up and down buttons simultaneously. Follow the on-screen instructions to resolve the issue. Once complete, press the on button to resume the patient therapy. Disassemble. When disassembling Thopaz Plus, you must first clamp the tubing. Clamp as close to the canister as possible to prevent fluid leakage once the canister is removed. Hold down the standby button for 3 seconds. Thopaz Plus will then revert to standby mode. Press the blue button to release the canister. You will then need to remove the plastic seals from the side of the canister and place them in the holes on the rear of the canister to seal. Pull the tubing away from Thopaz Plus and dispose of according to local guidelines. Now turn Thopaz Plus off and clean according to the cleaning guidelines provided by Medela. Thank you for your attention, and we hope you enjoy using our chest drainage management system.